This conference will now be recorded.
Good morning, students. Am I audible to you?
Yes, ma'am.
Today's applied exercise, WIDAL test, page number 178. In your record, page number 178. Applied exercise, WIDAL. All of you open your record, page number 178. So, your question here is blood sample collected from patient suffering with fever since 15 days. Okay, blood sample from patient suffering with since 15 days means 2 weeks almost. Okay, and having hepatomegaly. Then write your observation and give your report. So here, what is the test you should prefer? Which test? Anybody? And why? Anybody? Which test you will prefer and why? Huh? What is today's topic? Anybody? WIDAL, Deepti. Okay, good. Why WIDAL? For this patient. Amma, very important. This is in your practical exam and also important for theory also. Lab diagnosis of enteric fever or typhoid fever is very important for essay. WIDAL is one part of lab diagnosis of enteric fever and typhoid fever also. So WIDAL is choice of test here. Why WIDAL? Think logically. We have one table in lab diagnosis of enteric fever. We have one table. So first week of illness, preferable sample is blood culture. Then second week, WIDAL. Third week, stool sample. Fourth week, urine. Why WIDAL in second week? This is since 15 days means this is second week. Why? Antibody appear. Okay. When Deepti, when antibodies start appearing? Very good, Deepti. When antibody starts appearing at the end of first week and rise sharply end of first week only. Okay. Okay. No problem. And detect at the end of first week and rise sharply end of second week and third test is. So before going to questions, you should know few points about WIDAL. So this is the WIDAL is one of the oldest and most widely used serological tests for the diagnosis of okay. So till now, today also we are using WIDAL test for the diagnosis of enteric fever using wide and especially typhoid. Okay, so this was discovered by Fernand 1896. Okay, this is all. This is what is agglutination. Any agglutination? What is precipitation? Agglutination is a one type of antigen antibody reaction. What is the difference between agglutination and precipitation? All these points are very important for your viva. Huh? Anybody? So agglutination, no. Hmm? Only one difference between agglutination. Okay, articulate antigen. Oh, question. Vital at this stage, appearing in the serum, patient serum at the end of the first week. Okay, just start, but we can't detect. Okay, and rise sharply during the third week. Okay, third week or at the end of second week also of enteric fever. That's why here Vidal is choice of test. This table is very important and practical purpose also. So first week of entry there is blood Vidal. Third, so here agonist and H antigens, antibodies. We are detecting antibodies. Please listen carefully here. We are detecting antibodies from the patient serum by using antigens of Salmonella typhi and Paratyphi A and B. So we are detecting antibodies by using antigens. So what are the different antigens used in this Vidal test? See, this Vidal rack contains 4 rows. Okay, each row contains 7 tubes. I will explain in detail in the first row is for the detection of H. Then third row, fourth row is for the detection of H antigens of Salmonella paratyphi B. Okay, but why only O antigen? Only for Salmonella typhi here. This is common group antigen. This is a common group antigen for all the Salmonella species. this. Okay, because of the sharing of 12th factor. We see the Kaufman, this 12th factor is shared by all the O antigens of all the species of Salmonella. That's why this O antigen of paratyphi A and B are not included in this test. Okay, now first row is very important. First row is O antigen is H antigen of Salmonella type. Second row is Salmonella type. Third is H antigen. Fourth is sharing. We are not very important because of the share survivor factor. Is of Salmonella by all the members names, which is regions. We are detecting and Salmonella type of strain O and laboratory maintains strain. Kavya, am I audible to you now? Okay, thank you. Okay, see the procedure for all the first tubes. For all the rows first tubes, you have to add 0. Mean 0.9 ml of normal saline plus 0.1 ml of patient serum. 0.9 ml of normal saline plus 0.1 ml of serum equal to 1 ml. Okay, this is only for the first tubes of all the 4 rows. Then remaining all 5 tubes, you have to add only 0.5 ml of normal saline. Okay, then later, so now first tube contain 1 ml. Okay, normal saline plus patient serum. Mix well and then transfer 0.5 ml to second tube. From first tube, you have to transfer 0.5 ml to second tube. Then mix well and transfer 0.5 ml to third tube. Okay, like that. From the sixth tube, 0.5 ml for from the sixth tube, 0.5 ml 0.5 ml from the sixth tube you have to discard. Okay, this is the procedure for all the remaining 3 rows. Okay, this is now serial dilution finished. Okay, then add respective antigen 1 ml to each tube. For the first row, O antigen, typhi O antigen. Second row, typhi H antigen. Third row, paratyphoid AH antigen. Fourth row, paratyphoid typhi BH antigen. Okay, like that. So seventh tube, for all rows, seventh tube contain control tube. In this you have to add antigen plus normal saline to know the any auto agglutination of antigen. Okay, for first row control tube, you have to add O antigen plus normal saline. Second row, H antigen plus normal saline. Third row, paratyphi AH plus normal saline. Fourth row, paratyphi BH plus normal saline. Like that. You have to do doubling serial dilution. Then incubate at room temperature overnight. Okay, this is the procedure. 1 minute. So you have to draw like this. Not now. Okay, 4 rows. Okay, first row O antigen H B AH BH like this. Okay, this is the procedure. So this is also another diagram. Here they dilute with 1 ml, but in our lab we are doing with 0.5 ml only. So now these are the dilution 1:20, 1:40, 1:80, 160, 320 and 640. Usually up to here enough 640 and control tube. Next, here another important point is here 2 types of tubes are there. This is also important for Viva. For O agglutination, we are using Felix tube. This is round bottom tube. Felix tube, O agglutination. Small tip here is O means round. So round bottom tube for O agglutination. The tube name is Felix tube. But for H agglutination, the tube is with the conical bottom. See here. This is O agglutination Felix tube. This is conical bottom. Dreyer's tube for H agglutination. Okay. Results. So H agglutination pattern is here is showing large, loose, fluffy clumps. Large and H agglutination. Okay, am I audible to you? Here some network problem. Okay, try to adjust. Next, any antigen antibody reactions. We are what is the definition of titer? Titer means the highest dilution of sera at which agglutination occurs is called titer. ఇప్పుడు వచ్చిందండి. Me, usually in India, like in any country like India, people people contain some baseline antibodies, baseline titers for this enteric fever. So that's why for in India, especially in our places, we are prefer higher titers. Higher titers only significant. Okay, low titers should be ignored and considered as baseline titers. Okay, so here significant titer, this titer significant titer is this cutoff value is varies from place to place. Okay, here significant titer for O antigen is 1 is to 80 and above. For H antigen 1 is to 160 and above. This is important. Next, few more definitions. Okay, you have to interpret very carefully this WIDAL. Before interpreting, you should know the local titer of that particular place. What is local titer? Definition of local titer. In endemic area, low titer of antibodies present in the serum of normal persons. That is called local titer. So another important definition here is anamnestic reaction. Okay, what is anamnestic reaction? Very important for your viva. It refers to a transient rise of antibodies titer due to unrelated infections in persons who have had prior enteric fever. Okay, this is called anamnestic reaction. Another important point here is if you get high titers in all four rows, means all four antibodies are high in titer. It indicates recent vaccination, recent TAP vaccination. You should uh, correlate and all these points and then interpret the WIDAL test. Okay, these are very important. Now open the page number 178. Note down the question. Here for your question, note down this question. Exam suffering with fever since 15 days and having hepatomegaly and having hepatomegaly. Write your observation and give your report. Identify the given serological test. Answer. It is WIDAL. It is WIDAL. Tube agglutination test. Tube agglutination test for the detection of Salmonella typhi, comma, Salmonella paratyphi, A and B antibodies. A and B antibodies. Second question. What are antigens? What are antigens used in this test? Used in this test. O antigen of Salmonella typhi. O antigen of Salmonella typhi in bracket common group antigen. Common group antigen. Then second one, H antigen of Salmonella typhi. Third one, H antigen of Salmonella paratyphi A. Next one, H antigen of Salmonella paratyphi B. Next, third one, how do you identify? How do you identify? Answer, H agglutination pattern. H agglutination pattern, large, loose, large, comma, loose, comma, fluffy clumps. O agglutination pattern, compact, comma, chalky, comma, granular clumps. Next question. What is significant titer? What is significant titer? O antigen 1 in 80 and above. H antigen 1 in 160 and above. Next, report. Next question, report. The given test showing following titers. Typhi-O 1 is to 160. Typhi-H 1 is to 320. Para AH 1 is to 20. Para BH 1 is to 20. So here you see high titers, significant titers showing only Typhi-O and H high titers. H, that's why it is diagnosed as typhoid fever, not enteric fever. This is typhoid fever. Next question, serological test for the detection of carriers. Next question, serological test for the detection of carriers. Answer, VI antigen, VI. VI antigen. Remember, this is also important for the detection of carriers. VI. Vodafone idea. VI. Just tip only. గుర్తుపెట్టుకోవడానికి అంతే. VI antigen detection test for carriers. Significant titer is 1 is to 10 and above. Significant titer is 1 is to 100 and above. Okay. Leave one page after this. WIDAL, leave one page. Okay, like this. You have to draw. After you come back, you have to draw like this. So leave one full page after WIDAL. So, any doubts? Any doubt? Okay.